Thank you, guys. It's great to be here. Dobson DaVanzo, you're probably wondering, well, who's Dobson DaVanzo? We're a small health economics consulting firm in Northern Virginia. And the NAPT and Bob commissioned us to do the analysis of this survey. Now, this was the second round after his the results he just gave you. Let's see. Right arrow. There we go. Like Bob said, the survey was completed by about 2,000 patients, which right there, that's pretty unusual. We do a lot of surveys, and this was pretty amazing kind of a response, especially over the period of time that people were treated. This was pretty awesome because it spanned, 20 years, and that's an amazing thing. So as Dr. Lee talked about, the survey instrument collected demographics, it collected some clinical characteristics, it collected pre-treatment complaints, it also collected the health-related quality of life in the three areas, bladder, bowel, and sexual, and also hormonal. And then they added, for the version that we analyzed, they added a couple variables from the SF-36, which was used in the medical outcomes study, the self-reported health variable and the variable that says my health or my mental health problems don't interfere with my life too much, a whole lot, So those two questions give you a larger context on the quality of life. So as Dr. Lee said, it's expanded prostate cancer index composite, and a composite is just exactly what it says. It's variables put together. So it's a summation of the scores, and as Dr. Lee said, it goes from 0 to 100. We didn't understand the bother part. We weren't sure what that meant. So I'm glad you guys have told me it doesn't bother me, because I had a different concept. But anyway, the urinary subscale, in addition to functioning and bother, includes incontinence and irritation. So it hones in a little bit more on the specific symptoms. So the first thing we did, which every statistician does, is do the baseline characteristics to figure out who's in the sample. Then we calculated the EPIC scores. They also had an American Urological Association symptom index, and that gave a little bit more context in the symptomatology. It's just a single score, but what you'll see is that all this data goes in the same direction. That's what's so cool about this study. So then we cross-tabulated with time since completion of treatment and also type of treatment received. Dr. Lee mentioned that everybody got Proton except the 116 control people, but some got Proton with photon and some got Proton with hormone. So those were the three groups in our data, but most everybody was Proton only. So here's our distribution. You can see we've got people in every age bucket. We have people in the self-rated health. Again, it's the same that you heard in the earlier surveys. People are rating their health excellent and very good. And these are people that are up to 1 year from their treatment to, 10 years out, 12 years out. But they're all saying the same thing. That's what's so important. Some people had received surgery and such before. You can see the T stage in that. Everybody, 95% of people are in remission. So you can see the Gleason and everything. Here's the distribution. You can see, almost 1,500 just had Proton. 300 got photon, and then 186 got, I'm sorry, I mixed it up. Hormone was 302. Okay, in the satisfaction, first we compared the Proton, the whole bunch, against the controls. 99% of our respondents said they believed they'd made the best treatment decision for themselves. just like they did in the '09 survey, and 98% said they recommended proton therapy to others. That's pretty remarkable. Most people are not, they're not raving about their treatment. It's unusual. 96% were satisfied or extremely satisfied with proton therapy. And like in your survey, 92% reported their quality of life was better or the same today than it was before their treatment. 92%, this is that variable I was telling you about from the SF-36. It's the physical health or mental or emotional health. 92% said that these things don't interfere with their lives, their social activities. So here's the EPIC scores. People that had therapies that were in addition to proton had lower scores on. We were kind of surprised about that, but we found in 3 of the dimensions that the scores are lower for people that had received photon or hormone with the proton. So, as Dr. Lee said, a lot of differences. They look bigger when you have a big sample like that, and it'll be statistically significant, but it may not mean anything clinically. So it may mean, just a very subtle differences. So we're thinking that most of these, we're saying, well, there's a lower health-related quality of life in the sexual compared to the healthy individuals. But it's like relative. It's like a few points you can see on the scores. Here's the distribution of time since completion of therapy. You can see we have people all out, and almost 500 people are 6 years out. Dr. Lee looked at just the people that were 5 years and 6 years out on the theory that all the things that would have happened to them after the therapy would have happened and be in the past. But you can see it's a good distribution. So to us, what we were getting was really what people were reporting and not other things that the variables didn't pick up. Here's the scores. You can see there's very little variation except in the sexual summary score. You can see it drops off as people get older. We don't think that's, we don't think that's exclusively because of the proton therapy. There's lots of things that happen as people get older. Look at the other scores; they're just remarkably the same. For people, I've done lots of analyses, Medicare current beneficiary survey, all these different surveys, and I've never seen everything be so much in the same direction. So that's all I really wanted to tell you. We have a report, and that's on the NAPT website. There's an executive summary that's outside, and if you want to know the detail, it's all in the report. But we're looking forward to Son of Bob survey. So thank you very much.